Good afternoon, Neil John. My name is Mihiraa. Let's start the warm-up session. What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Your preparation time is over. You can now start your roleplay.
Mihiraa, could you tell me a bit about how the wound has been since you left the hospital?
Yes, it's been more painful than I expected. There's also been some redness and a bit of fluid coming out. I wasn't sure if that was normal or not.
Thank you for sharing that with me, Mihiraa. From what you've described and from what I observed during the dressing, it does sound like your wound is infected. This is something we see quite commonly. The signs of infection include redness, swelling, increased pain, and sometimes drainage from the wound, which are all symptoms you're experiencing.
Is it very complicated? What can be done right now?
It's completely understandable to be concerned, especially when it comes to your health. Although it's never pleasant to hear that a wound is infected, the good news is that it's something we can treat effectively. Mihiraa, I want to reassure you that wound infections are quite common, and with the right care, you'll be on the mend soon. There are several treatment options available that we can use to address the infection. First, we might need to clean the wound thoroughly and, if necessary, drain any fluid that has built up surgically. This will help reduce the infection and allow the wound to heal more effectively. In addition to that, I'll prescribe you a course of antibiotics. These medications will work to fight the infection from within your body, and you should start to feel some relief within a few days. I know this might feel overwhelming, but please know that we're here to support you throughout the entire process. Do you have any concerns about the treatment, or are there any questions you'd like to ask before we proceed?
I just want to make sure that this will clear up soon. How do I manage it at home effectively?
Mihiraa, now that we've started treating the infection, it's very important to follow a few steps at home to help your wound heal as quickly and comfortably as possible. First, your doctor will be prescribing a course of antibiotics for you. It's really important to take them exactly as directed, even if you start feeling better before the medication is finished. This ensures that the infection is completely cleared and helps prevent it from coming back. To ensure optimal healing, it's crucial to clean the wound gently and frequently. Regular dressing changes help maintain a clean environment for the wound to heal. It's also important to keep an eye out for any signs that the infection might be getting worse. If you notice increased redness, swelling, more pain, or any unusual drainage from the wound, please seek medical attention right away. These could be signs that the infection needs more attention. I know this can feel like a lot to manage, but remember, we're here to support you.
Sure, I am ready to follow your instructions.
That's a good decision, Mihiraa. Now, as we begin your treatment, it's very important that we keep a close eye on your progress to ensure everything is healing properly. I encourage you to come in for regular follow-up visits so we can monitor how the wound is responding to the treatment. These visits give us the opportunity to make sure the infection is clearing up as expected and to adjust your treatment plan if needed. By seeing you regularly, we can catch any issues early and make sure you're healing as comfortably and quickly as possible.
Yes, that sounds good. Thank you, Nurse Neil. I feel a bit more at ease now.
I'm glad to hear that, Mihiraa. Now, I need your consent to begin your wound treatment. If you're ready, we can start the treatment now.
Of course. You may now start the treatment.
Thank you for your consent, Mihiraa. Before concluding, let me summarize what we have discussed so far. You mentioned that your wound has been more painful than expected, with some redness and fluid discharge. From what you've described and what I observed during the dressing, it seems that your wound is infected. While infections can be worrying, I want to reassure you that they are quite common and treatable. We've talked about the treatment options, which include thoroughly cleaning the wound, possibly draining any built-up fluid, and starting you on a course of antibiotics. These steps will help the infection clear up, and you should start feeling relief within a few days. We've also discussed how important it is to follow the prescribed antibiotic course fully and to clean and dress the wound regularly at home. Mihiraa, you will need to watch for any signs that the infection might be getting worse, such as increased redness, swelling, pain, or unusual drainage, and seek medical attention if these occur. Lastly, I've emphasized the importance of attending regular follow-up visits. These will help us monitor your healing and make any necessary adjustments to your treatment plan. By doing so, we can catch any issues early and ensure your healing as comfortably and quickly as possible. I'm glad to hear that you're ready to follow these instructions, and with your consent, we can start your wound treatment right away.